Knowing an overdose definition can save lives. We hear a lot in the news about people ending up in the hospital or even dying after taking an overdose of drugs. But what exactly is an overdose? Also, by knowing drug overdose signs and treatment, we can minimize the deaths as we can provide our support to get rid of those situations. So, in this video, we are going to discuss about drug overdose signs and treatments. Let's go to the video. What is a drug overdose? Also commonly known as an OD, an overdose is a condition of taking a larger dose of a drug than the body is able to handle. Overdoses can occur accidentally, even when a drug is taken as prescribed or deliberately as a suicide attempt. If you are having suicidal thoughts, contact the National Suicide Prevention Lifeline at 1-800-273-8255 for support and assistance from a trained counselor. If you or a loved one are in immediate danger, call 911. The Centers for Disease Control have reported an increase in the number of deaths from overdoses from taking synthetic opioids other than methadone, which includes drugs such as tramadol and fentanyl. In fact, in 2021, more than 28,000 deaths involved synthetic opioids, which is more deaths than any other type of opioids. Part of this increase may have to do with the potency of synthetic opioids. For instance, the CDC indicates that fentanyl, a man-made opioid, is 50 times more potent than heroin and 100 times more potent than morphine. Sometimes people overdose through carelessness, and sometimes they don't know how strong the drug is that they are taking. They may not know how much is a safe amount for them. This fact is especially true if they are inexperienced in drug use, have recently lost weight, or had a period of abstinence or reduced drug use. Taking street drugs, which may be mixed with various other substances, also increases the risk of overdose. Preventing overdoses. Parents can prevent overdoses in their homes by keeping their prescription drugs away from their children and pets. Increasingly, many children are internationally experimenting with and abusing their parents' prescription drugs to get high. So, parents should keep these medications away from not just small children but teenage children as well. If you are addicted to drugs or alcohol, it's better to enter a treatment facility where you may be able to receive prescription methadone or to be monitored as you go through withdrawal. If you recently completed a treatment program and are tempted to try drugs again, avoid taking the usual hit of your favorite drug. You may not realize that your tolerance has been lowered during detox, increasing your chances of an OD should you get high again. Signs and symptoms. A person who has overdosed may lose consciousness, vomit or be confused. Their skin may become cool or clammy, the pupils may look like pinpoints, and they may make choking or gurgling sounds. Their vital signs may worsen. Get medical help right away. Don't try to revive the person on your own or abandon the person because you're afraid of getting in trouble. The individual's life rests in your hands, and you could get in legal trouble anyway if it's discovered that you supplied drugs to this person or abandoned the individual during this crisis. Additionally, the CDC indicates that many states have Good Samaritan laws in place that protect both the victim and the person requesting medical help for the victim from drug possession charges. If the person receives help in time, they may have their stomach pushed out, given activated charcoal or medicines to counteract the drugs in their system. The medical staff will also work to improve the patient's vital signs if necessary. What can be done to prevent a drug overdose in the first place? A drug overdose is usually the last stop in the long process of drug addiction and abuse. Before an overdose occurs, there are many signs and symptoms that a person is suffering from substance or alcohol use disorder. Supporting and encouraging someone to enter an outpatient or inpatient rehab center can enable them to achieve sobriety and stay away from drugs or alcohol. The earlier in the addiction process that a person gets help, the more likely the outcomes will be successful and they will achieve lifelong sobriety. Early intervention can also uncover comorbid or co-occurring health conditions that are the root cause of someone's drug addiction. Often, people with untreated mental health disorder symptoms will turn to drugs or alcohol to find relief. It's crucial that root causes are addressed early to prevent an overdose from happening. If someone is concerned about a loved one's drinking or drug use, please contact a licensed rehabilitation facility. Representatives are standing by to assist loved ones with the treatment process and answer any questions they may have about availability, scheduling, and insurance coverage. In this video, we discussed about drug overdose signs and treatments. If you got this video helpful, please give a thumbs up to the video. Don't forget to share this with your friends. Subscribe the channel for more important videos like this. Thanks for watching.